Hello, everybody. Welcome. I am Dr. Monica Dweck, and I'm the Director for Career Planning Services for Mount Sinai Medical School. And I just wanted to say the purpose of our meeting today is to try to connect Mount Sinai alumni to current fourth-year medical students in certain different specialties, to give you a sense of what their journey has been, how they made their decision, and what they've experienced in their professional life. So at this point, I would like to introduce Dr. Victoria Dahms from pediatrics, and you have it, Dr. Dahms.
Okay. All right. Hi, everyone. So thank you for having me. I'm certainly happy to go through any questions. I'll introduce myself a little bit and then certainly talk through any questions or concerns now or at any later date. So again, my name is Victoria Dahms. I went to medical school at Mount Sinai. I did all my medical school there, and then I stayed on for my pediatric residency also at Mount Sinai, and then stayed on an extra year to be a chief resident at Mount Sinai as well. After that, I actually left Mount Sinai for a little bit. I joined a private practice in Bergen County, New Jersey, practiced there for about 5 or 6 years, and then through a couple of things, which we can talk about if you desire, ended up back at a Mount Sinai practice. So right now, for the last 9 or 10 years, I've been back at Westside Pediatrics, which is a Sinai-affiliated voluntary practice on the Upper West Side. So I've been here now for the past 8 or 9 years. So I currently practice in primary care, general pediatrics, at a voluntary practice that's affiliated with Mount Sinai.
So if there are questions from the students, you can put them in the chat format, or you can unmute yourself and ask directly. In the meantime, Dr. Dahms, could you give us a sense of how you feel Mount Sinai helped to prepare you for the residency program?
Yeah, so certainly, again, so for me personally, third-year medical school, I went into third-year medical school very, very open-minded. I really enjoyed all of my different rotations. I had been considering doing potentially medicine or med peds or pediatrics, and then towards the end of third year decided to just, stay with pediatrics, which I felt, thought there was a great environment as a medical student for pediatrics. The attendings were great. And for me, I knew I was going to be staying for personal reasons in probably the New York City area. So I looked very closely at all the New York City programs, and decided, after a lot to stay at Mount Sinai, which again worked out, wonderful for me. I think it's an amazing training program. I think, again, the pediatrics department is very supportive. I think any medical student who wants more, mentorship or experience are definitely taken, very seriously. It's a very comfortable kind of small department in a lot of ways. So I think anyone looking to do pediatrics here really should just take advantage of all the attendings. Both the hospitalist service, the subspecialists, and even like all the voluntaries in general pediatrics are also, again, very willing to have medical students for any, questions or concerns that come up.
Hi, Dr. Dahms.
Hi.
Thank you so much for doing this.
No, of course.
Sorry, I don't want to interrupt you.
No, that's okay. How's it going?
Good. So I think, because all the students start on their clinical rotation, so they may be rolling in also a little later too. And you said we can, if people have other questions, we can.
Yeah, certainly, like I said, obviously, if someone wants to reach out to me, privately, I'm happy to pass on my personal information and just have them reach out. We can talk about, again, things that are more specific. In terms of that. I've also done some, last couple of years, I've done interviewing for the residency program, both in Sinai. going through those applicants and kind of going through, again, kind of, what to expect in these interviews. And I've done the interviewing for the last, couple of years. As a chief resident, a huge part of what you do is kind of the recruitment for the incoming resident class. Yeah. I've always kind of stayed up with, doing the interviews, which has always, been fun to do. And certainly if people have questions about that or other things, I'm happy to discuss that further as well.
Did you hear about how the residency program is changing? Or the applications are changing with the early? Okay.
Yeah, I mean, certainly, Jessica Reed Adam, who's now taken over from Joel Foreman, who was there for honestly, since I was a chief. He started when I just started 10 years later, and Jessica's been taking over since last year. So we're definitely, very, keeping on track of what's going on with them. And Jess is great. Certainly with COVID and all of that, there's been even a lot more kind of interdepartmental communication with the hospitalists and, even the private. So certainly, I feel like we've been keeping in good communication. I have a good idea what's going on over there.
Okay, looks like you got a question.
Yeah. Yeah. Yeah, so I'm looking at the question that if everyone can't see, it says, discussing your decision between pediatrics and other specialties you mentioned, and interview perspective also sounds great. So, yeah, I mean, certainly, some of it obviously is kind of, what do you envision, doing? What kind of patient population do you want to be working with? Do you see yourself taking care of, chronically ill people? Those sort of things. Certainly with pediatrics, one of the best things about it is development, right? So child development is something that certainly you need to be, very interested in and, want to take a good amount of your time doing, because so much of it is development over time. And all that, especially general pediatrics. Certainly there's also chronic illnesses in kids. So just how you kind of look at that and how you want to just see yourself, the kind of patients you want to be taking care of. There's also a big setting, question of, I remember, again, when Alexis and I were in med school, one of our mentors saying, listen, in any part that you choose of medicine, you can find a way that you want to practice in some ways. So whether that's in an office, whether it's hospital-based. So I think there's a lot that can go into that. You can find different niches for kind of what you want to do in terms of your practice setting. But I think a lot of it is, do you want to be dealing with families? Do you want to be kind of long-term care with someone? Is that something you're more interested in terms of whether it's primary care or something, or ER style things? So I think in terms of nowadays, there's a lot of change in terms of whether you're hospital-based and you're doing shift work or whether you're private practice-based, and it's different. So I think there's many different things that kind of go into, but I think a lot of it is just thinking about what kind of patients do you want to be taking care of, because I think the way how you're going to see those patients, you can find variability depending on any specialty you kind of go into. And for me, a lot of it was just really wanting to get to know families long term. Child development for me had been a big deal. If I do this, I probably would have done neuropsychology or something in terms of development in children and stuff like that. So I always really look to that as something very interesting, for me. But again, even in residency, your thoughts change a lot. I loved the PICU, the intensive care units during residency. I loved that kind of medicine. It was great. I felt like it was just very, obviously intense. And but looking for me long term, I couldn't imagine taking care of those patients and that being kind of the patients I took care of every day for the rest of my life. It just wasn't what I saw myself doing forever. So even within pediatrics, there's different ways you can kind of look into that. Again, interview perspective, I'm assuming the crowd I'm talking to are people that are clearly at least thinking about peds or definitely doing peds. I think in general, as with most things with pediatrics, people are generally nice, so I think you're not going to get crazy tough questions in terms of interviews or anything where they're putting you on the spot about academics or things like that in terms of asking you those sort of things. I think they just want to get to know you, and kind of see what's your perspective, what kind of person you are, what are your interests, what do you have that makes you interesting to kind of bring to a residency program outside of just being, a physician. So in general, I think, pediatrics, we're just trying to kind of again, we want nice people who obviously are smart, and all of that is going to be certainly obviously important for that, but also just who do you want to be working with, who do you want to be spending time with, would I want to be on call with you, kind of based on both how you've done academically and also just socially how you interact with families and your colleagues. I hope that kind of answered that. I feel like I'm rambling a little, but
It's great. Anna, I think are you the only medical student on right now?
I might be. I'm not familiar with who Anastasia Hagen is. It might be someone else in my class.
Okay, yeah. So lucky for you, you get like very personalized attention.
So bad at coming up with questions, so I'm probably the worst one here.
If it's just you and I, and you want to talk personally about more what you're thinking, and it's just the two of us, I'm happy to do that. I don't know how much you want to share on Zoom, but.
Yeah, I'm pretty certain I'm applying to pediatrics, and I think similarly would like to stay in New York. So maybe talking more about like the different programs in New York and what you found interesting about all of them would be helpful.
Yeah, I mean, first what I would say, my best advice honestly would be, and Alexis, you can tell me if something's changed with COVID and all that, maybe it has, or you might know also, Anna, is trying to spend time in some of these other hospitals. You know, I definitely, did I lose you guys? Am I still there? Okay. Yeah, so try and do some rotations in some of these places, you know, if you can. I don't know if that's being, you know, with everything going on, minimized now with everything going on with COVID. But
actually, no rotations this year.
None. Okay,
None,
so
yeah.
no, you can't go anywhere, sort of thing.
I can't go anywhere, yeah.
Okay, all right. So that's a bummer. I definitely felt like that was something that was definitely helpful, obviously, in terms of getting to know a place. You know, I'd spent time at Cornell. I was familiar with Columbia. Again, depends on how close you are. Certainly, Columbia, Cornell, NYU, you know, Einstein. Depending if you're interested in the LIJ North Shore practice. I think they've changed in the last, since I'm not as familiar with them, but those are certainly kind of the big, you know, the big programs in the city. And like I said, I mean, they all have, I think they're all definitely good programs. Like I said, personally, obviously stuck with Sinai as my favorite because I felt like it was a really good medium-sized program. I felt like there's a lot of camaraderie between the fellows and the residents. I thought there was a good balance between certain specialties having fellows, but you still had good access to the attendings. Columbia's, also great. One of my colleagues, you know, just finished at Columbia a couple, you know, years ago. My practice is a very Sinai practice. We've all did med school and residency, everyone except for the one I just mentioned who joined us from Columbia recently. We were all very Sinai based. My colleague at Columbia really enjoyed her residency. Again, I think there maybe it was a little more with some of the fellowships that it was a little harder to maybe get to some of the attendings because it's a little more fellowship driven than I felt Sinai was. But still, I think, you know, if you're talking about any of those programs, I think it's great. I think, again, not being able to rotate there is kind of, I'm sure, going to be a little tough, kind of getting to know the programs. But if that's the case for everybody, then that's the case for everybody. So at least it evens out the ball field versus interviewing against someone who did a month there, sort of thing, if no one's going to have the option to do that.
So, yeah, I think that's the key is everyone's in the same playing field because no one can go away for rotations.
Yeah.
Dr. Dahms, what type of changes do you foresee for your specialty in the future?
So it's a good question. I mean, certainly in some ways, I feel being a private practice-based pediatrician is in some ways going wayward. You know, when I mean private practice, I mean we are like our own business. We are independently owned. My two colleagues started the practice. Interestingly, the history of my practice is it started as a Sinai-owned practice. They had, I think, bought the building here on the Upper West Side. They put a pediatrics office in. They put a medicine office in. They put an OB/GYN office in. And over the years, you know, my two colleagues have bought out the practice and they now own it. So we function as a small business, which again, is interesting in a lot of ways. I think that certainly is changing a lot. Most hospitals have been buying up a lot of practices. A lot of the, in terms of general pediatrics, most places are now hospital owned. So I think it is kind of the way it is. I think it's changed in some good ways and some bad ways, depending on how, you know, the individual physicians look at it. Obviously, we like the autonomy, you know, like our small office, we know everybody, we make our own schedules, we're not kind of pushed in a productivity way based on like some like hospital administrations, things like that. But I certainly think it is changing to where most places are going to be kind of more hospital based. Certainly things in pediatrics that changed. You know, when I started my training, you know, I took care of all of my own NICU babies and took care of all our hospitalized patients and all of that. That is something that's definitely changing in pediatrics. But, you know, now that we're seeing more and more hospitalists, they're kind of taking over a lot of the inpatients. So that's something to consider if you're thinking about primary care, but love that inpatient. Is that something that definitely over the years is changing? I'm sure is going to kind of continue to change, where that's much more going to be really hospital-based. Hospitalists are going to be taking care of those inpatients, and that's something we definitely see is changing in general pediatrics right now. So again, more hospital loans, more a little bit of a separation of kids who are getting hospitalized care versus you know, primary care in the office setting.
How's your practice been since like pre and during COVID?
Yeah, so I mean, it's interesting in some ways, being that we're a small business, you know, and obviously with everything going on in New York, you know, our recommendations were really to only see babies who basically 15 months and younger who needed their initial vaccines and their first set of vaccines. So certainly that really cuts into, you know, what we're seeing in the office in terms of volume and in terms of running a small business. Again, luckily we've got great patients and we have a lot of flow and all that, so we, you know, we're able to manage fine. But in terms of the business stuff, which again is like depending on how interested you are, you know, I can talk about it more, but things like needing PPE loans and things like that. You know, people again following pediatrics, you know, some offices had to close because they couldn't afford, you know, the overhead and all the things that comes to kind of running a small business in a situation where your patient volume is down. For us, I mean, luckily, you know, we were able to get through it fine. Starting a month ago, we started opening up and we're seeing more of our patients, more just older kids checkups, which has been going well. But that being said, it's different. You know, we're all doing, you know, we're spreading out our appointment times, you know, so no one's ever sitting in the waiting room. You know, we're a city practice, right? So there's real estate's a problem, right? We only have so many patient rooms. So, you know, we can't have as many practitioners in the office at the same time. You know, so each of us are doing telemedicine from home one day a week just to kind of, you know, have that, you know, freeing up some more space in the office for people to see checkups. So, and in terms of medically, you know, luckily, like I'm sure you guys know, kids in general have fared very well during this, you know, during this virus. So luckily, although we've had kids who are sick and everything, most of our kids have done very well, which is great, and have been mildly ill. Again, depending on how much, you know, the multi-inflammatory system disorder, we again have had a patient actually too with that. Then both of them luckily have done well. So it's definitely changed, again, in some ways in how we practice, but also pushed us to kind of do telemedicine, which we probably should have been doing for a long time. You know, so we wrapped up very quickly at that, and that was, you know, I think very helpful both for us and for our patients to be able to do things like that.
Yeah, definitely. Anna, do you have any other questions?
I just sent one over.
Okay.
Basically, like, what does it look like when you leave residency in peds, especially if you're, you know, going into general pediatrics like yourself? I feel like that's just not something we really talk about. So I was not really sure what to expect on that.
Yeah, right. So, I mean, certainly, like, I'm sure, like, you know, basically you do your 3-year peds residency, and then depending on your path, you know, you can do either fellowships. Most pediatric fellowships are going to be 3 years, or you can do something like a chief year and then a fellowship. In terms of nowadays, you know, years ago, you know, when I finished, a lot of people would do like general hospitalist medicine potentially right out of residency. That is something that's definitely changed. You know, now since there are hospitalist programs, pretty much it's going to be very hard to be hired anywhere that's not kind of more rural for a hospitalist program without doing that specific fellowship. That being said, I think a lot of the programs do train you very well. I think as residents, you're actually, I feel at Sinai got a very well-rounded education. I could have walked into a PICU fellowship just as easily as I could have walked into a primary care office and start, but different residencies, it is a good question to ask about some residencies, because some are a little more feeling like you walk out of there very trained to be a hospitalist, but maybe not very trained to be in primary care if it's not something that they kind of push, or your clinic time isn't something that they focus on a lot in terms of like your continuity clinic. So it is something kind of thinking about what you want in terms of how they kind of prepare you for both. I still think it's absolutely possible to enter general primary care pediatrics right out of a 3-year residency. You don't need, again, subspecialty training. I mean, certain people might decide to do an adolescent fellowship or something like that, but most people, I think, if you're going to do general peds, can definitely walk out of it right out of residency. But certainly hospitalist programs, again, anywhere that's not particularly rural, you're probably going to do a hospitalist fellowship.
Thank you so much. You mentioned the PICU, and it reminded me I just got assigned the PICU for my sub-I, and I was wondering if you had any advice for that, for students in the PICU in particular for sub-Is, and I guess just in general for how to sort of navigate your life on a sub-I.
Yeah, I mean, absolutely. I mean, a lot of it is certainly, like, it's like everything about being a medical student. It's like you're trying your best to show interest and be enthusiastic without, like, getting in people's ways in some ways, right? So, like, sometimes it's, you want to just kind of be there, certainly ask a lot of, I think it's totally appropriate to, ask questions, and all the obvious stuff, certainly things like, getting there early to make sure you've kind of gone over all the vitals. If you have questions, I mean, honestly, even in the PICU, the nurses are a great, source of a lot of helpful information too, and the residents. So, I mean, I think it's not so different than any other rotation you would kind of go into, in terms of just, asking questions, just knowing your patient, whoever you get assigned. I mean, my biggest thing would be to know that patient inside, outside, backwards, forwards. Like, so you really take a lot of ownership. I think, attendings, students, residents really notice that. If you take a lot of ownership and really feel like you want to know everything about your patient, it really goes a long way in terms of just showing your interest and your enthusiasm. And again, you're learning, about what's going on with them.
Great. So Victoria, can I ask you one question? We have, we're trying to formalize like the mentorship program. And so we actually have a database that we're putting people's information in so that students can contact you. Can we put you in there? Okay, great.
Of course.
All right, well, Anna, I guess if you don't have any other questions, maybe we'll let Victoria go early and get home to her 4 kids.
Oh my goodness, yes, do that. I'm good on questions. Thank you so much for doing this. I really appreciate it.
No, obviously, reach out, especially as it gets closer to, like, interviews and things like that. I think, again, having this kind of, whether it's to the Alumni Association and all of that, but using all of the people here, I feel like even that, I stayed at Sinai, so it was kind of easy for me in some ways, because it's like you make all these relationships, but certainly also if you're going out, you never know who, best friend was at Columbia for residency, or who knows this person, who knows that person. So definitely using, who trained at Sinai and went on to practice at Montefiore or something like that. There's a lot of things. I do feel like things that are different now than when I was around is that people move around a lot more, I think, than years ago. I think years ago, a lot of people kind of stayed in one place or found the job they were going to kind of have forever. And I feel like that certainly happened a lot less. So people have experience with other places and can be great, sources of information about things. So definitely using, people through alumni and all of that to kind of help you.
Dr. Dahms, I think we have a student that just joined. Brittany, are you on, Brittany?
Hi, yeah, I'm on. Sorry I'm late.
Hi, that's okay. We were actually going to wrap up, but we'd love if you have any questions for Dr. Dahms that you kind of had. She's with us, so
yeah.
feel free.
I'm actually applying. I'm on 4th year now, applying into med peds. And so I'm just curious if you have any peers who did med peds and if there's any advice down the road that you have.
Sorry, I mean, you cut out there a little bit. You said you're applying in med peds?
Yeah, and I was just curious if you have any peers who were med peds trained and if you have any advice.
Yeah. So, you know, and honestly, someone will have to remind me, is Sinai's med peds program back up? Because honestly, it was very kind of big when I was a med student, and I almost actually did med peds myself, and then ended up to just go peds. So there definitely are people who trained around my time who did med peds. I mean, and when I was a chief resident, we had still med peds residents at the time. So certainly I'm not that familiar with the programs now as I am with the pediatric program. So I'm not sure who has active programs now that you're looking into.
So Sinai just restarted it about 3 years ago. So that one is back. It's the only one in New York.
Yeah. Okay. So yeah, I mean, like I said, you know, certainly I'm not as familiar with, you know, who's running it right now, but certainly we definitely had people, and I will say some of my MedPeds colleagues had gone on to do some interesting things, you know, really interesting things. Like the person I'm thinking of now runs like a whole like medical system down, sorry for 1 second, you know, downtown, and other people have done various things. I know a lot of people at the time, I'm not sure where they landed, were thinking about some like niche-ier sort of stuff, like following adults who had like congenital heart disease and some other kind of niche sort of things. The person who ran the program when I was there was Jen Kessler. I think she's in Westchester right now. But I certainly could probably, you know, kind of put together some resources and some people and kind of see where they ended up who could get in touch with you.
Thank you so much.
Yeah. So just, I think Alexa said she's going to put my information somewhere you guys have access to it, so you can just get in touch with me, and we can try and put you in touch with some people.
Okay, great. We can send you the link for that. All right, I guess I'm going to take one picture so we can give a shout out to you on our social media stuff. Because that's the thing we do now. And then I guess for Anna and Brittany, if you guys want Dr. Dahms, we're going to put her in the database, Alumni Connect. So then that way, if you want, you can like formally contact her, and you know, if you're interested in finding a mentor, just having questions.
Awesome. Thank you so much.
Thank you.
My pleasure.
Thank you so much, Victoria.
My pleasure, guys. Get in touch for anything you need. Great seeing you, Alexis.
You too. Bye.
Bye.